Welcome, everyone, and we are back with the Slices Right podcast
Hello, everybody.
in beautiful, sunny, and hot Scottsdale, Arizona.
Yes. Welcome. Thanks for joining, everyone.
Hope everybody's doing well out there. We have some exciting new products to show you here, and we are talking about some exciting plastic surgery operations.
Yeah, so we're today going to talk about some tools that we recommend. They're not necessary, but I think we recommend them for certain major body contouring surgeries we do that can limit mobility and make otherwise easy activities difficult.
Totally agree. These little products are handy. They're inexpensive. You can get them on Amazon delivered to your house, and I think they'll make your life a lot easier when you have a big surgery or even a smaller surgery.
Well, yep,
but let's talk a little bit about some of these products. What do you think about this thing?
The grabber, yeah. You know, a lot of our surgeries, you can't really lift or move your arms or bend too far, so reaching far things can be tough.
Right, so the grabber's great. We do some operations where we definitely recommend that you don't bend over to pick up things that you might have dropped. The grabber's going to really help you. I got a little example here. Dr. Oakley was wondering what this Coke was about. I am going to drink it before the podcast ends.
Look how easy that is. Wow.
But yeah, so let's just say that you've had a procedure like tummy tuck, body lift, thigh lift, and we'll talk about why these are important with these surgeries in a minute, but we definitely recommend the grabber. And I got a surprise for you. I don't know if you've noticed, but I'm a little taller than normal.
I did think something was up, yeah.
And that's because I have a lift. I have a 6-inch lift.
You've had a lift. Okay, let's see it.
That's right. You want to see it? Yeah. This is another one of these products that we recommend. I'm going to just pull it out. Don't be scared, everybody.
I know. Okay. Yeah.
Here we go. Here it comes. Oh yeah. That's right. It's let me do it justice. It's an elevated toilet seat. Now, what do you think about this one?
Yeah, to minimize how much bending you're doing while sitting down and going to the bathroom.
Yeah, so this is 6 inches. There's also a 3-inch option for shorter people. But I definitely think when you've had a body lift or a thigh lift or a tummy tuck even, it's just easier to just have that extra height.
Yeah.
Yeah. Now this one's never been used before.
I hope not.
There was a slightly used one on sale on eBay, but I got the brand new one from Amazon.
Good.
Yeah, I made sure that I took the tag off myself.
Yeah, okay, just right now, hopefully.
Anyways. But you can also, it's got some other uses. Once you're done with it, right, what do you do with it, right? So you could just put it up and pretend that you're flying. You could do that little
window
Instagram.
seat, airplane window seat, yeah.
And what else? I think you had another good idea. It might not work.
The headrest for when you're sleeping on a plane,
Yeah, go ahead and hold that for me, Scott.
Okay, here. Yeah.
He's stronger than me.
Yeah.
That thing's, it's not that heavy, but
it's solid. I think it would work, and I think patients tend to, feel like this is it's helpful for just making bathroom use a little bit easier. That tends to be the tough thing, sitting on toilets and squatting down too much. Which, speaking of difficulty squatting down, we have another product here that kind of helps with that as well.
Well, Dr. Oakley here, he is the expert at this device in our practice.
I've played with it enough now. I know how to use it, but it's called the Conch. And what it is just goes by many names, the Shiwi, the Go Girl, but it's basically a little on-the-go thing to help to go pee.
That's the perfect color for a lady, yeah.
Yeah, exactly.
Love
you can hook up something to this. You can go while standing, while squatting. Makes it a little easier, and then it telescopes back down to conveniently, after being washed, of course, conveniently package nicely and discreetly, like that.
I can tell you from experience that is the most highly rated product that we recommend for our post-operative recovery. And, we do a lot of tummy tucks and body lifts and thigh lifts, and those patients love that device. Mm-hmm. You might not need the toilet seat as much if you have the Conch, but eventually you might need this. Most patients have a little constipation after surgery, 5 days. You'll definitely have to sit down when you do go. But most of the time we're talking about keeping you well hydrated. And one of the signs that you can follow at home as a patient is you can urinate every 2 hours, a full bladder. That means you're well hydrated. The Conch comes really handy.
And the urine that's clear. That's when you know you've been drinking a lot of water.
Now, if you practice, you can get really good at writing your name with it. And you can impress all your friends.
Yeah.
You know what I'm saying?
Feel like a little boy. Little boy again.
But let's talk about a case that we have some pictures of a case that we might actually use these 3 cool devices on, and it's a thigh lift.
Thigh lift. So we have, we have 3 common major body contouring surgeries we do. Like the biggest ones are the tummy tuck, the body lift, and the modified spiral thigh lift. And this one is one of yours, Dr. Guerra, of the modified spiral thigh lift.
Yeah, so let's look at this preoperative photo. Let me tell you what's typical about these patients. They've already tried everything else to get rid of the cellulite in their thighs. They've tried all the non-surgical, expensive, minimally invasive procedures. They've tried liposuction. They've tried vaser lipo. You name it. They've come to my office really sort of in despair, I guess, and nothing else really works for them except this modified spiral thigh lift. And let's look at the markings very carefully. You'll notice that the markings are in the green ink, and the areas that are inside the green ink is what's actually going to be excised in the typical patient. The little circle in the buttock, we're going to use some of that fat to augment the buttock, not a BBL like in Miami where they're, as big as a house, but what we're talking about here is giving him a nice round tushy.
Yeah. I think what's surprising is seeing, these patients, you wouldn't expect them to have such laxity or that much tissue that can be removed. And it's pretty impressive to see the markings and see what is able to be excised to get that buttock lift and tighten up the inner thighs around the lower butt and the groin region.
It's true. The amount of skin that's removed is impressive, but we designed this surgery here. We used some modifications that other doctors had created. We mixed it all together to get just the perfect recipe to be able to get rid of probably approximately 85 to 90% of the cellulite, all the way down to the mid-thigh. In the buttock region, patients look tremendously well. Let's show her after picture here real quick. And you can see that the typical result.
Impressive.
How about the front shot? Because I actually think she also looks great in the front. And so this thigh lift effect goes all the way around the thighs. It affects the front of the thighs. It affects the lower tummy. So look at those markings right there, as you can see what we're going to be removing again. And that's her after result right there.
Very impressive. Looks great. Turned back the clock many, many years. And, a lot of that skin smoothing just makes the thighs, the back of the buttock look really nice.
Yeah, let's look at the markings again, the green markings, if you don't mind. Here they come. How about the backside? So the reason you're going to need this grabber is because it's going to be tight in the back. In fact, I think that the back is going to be the tightest part.
Yeah.
So any little bit, 15 degrees of bending over, and that wound could potentially have a dehiscence, what people would call an opening, a split. And we've never gotten one of those in the back, right in the middle there. But I think because patients use special precautions.
Yes, we prepare them well before surgery. They know their limitations and they know what they can and can't get away with before they get into the surgery.
Absolutely. Yeah. Now, other precautions with regards to the wounds, you don't want to spread your legs open too much, like you're riding a horse within, let's say, 3 weeks after the surgery. You don't want to swing your legs to get up into a high bed or something like that as well to prevent, wounds. But these devices will absolutely come in handy, in particular in that type of case.
Very much so.
Let's go back and look at a comparison of the before and after once again on the modified spiral thigh lift, and let's talk a little bit about that again. So this case also illustrates, Scott, I don't know if you've noticed some of the intricacies about the result, but the patient looks wider in the preoperative photograph. Her hips are wider, her abdomen is wider, and I think that's, and afterwards, she looks thinner. She looks slimmer and thinner. She's been pulled up. Gravity has restored the tissues where they used to be when she was maybe in her 20s. Yeah. But she looks like a thinner person. And
it's a very powerful surgery.
I think that what that comes from is it's the liposuction that we do before we remove the skin.
Yeah, it's not just skin removal. It's the fat underneath it, too. And liposuctioning that fat prior so that we can remove as much as possible before essentially avulsing the skin.
Yeah, we remove the skin with a special technique that looks a little brutal, but actually does a great job. And the biggest benefit is no drain.
No drains.
No drain whatsoever.
Requires 0 drains, which is another big plus for our patients.
Yeah, so feel free to look these products up. We are probably going to put a link to Amazon for these 3 products. And one other thing that I want to just say is that we do have some announcement for this podcast, and we're going to let Dr. Ugly do it because I think his patient was the winner of last month's photo challenge. Is that right, Scott?
Yeah, so we just held our April Guerra photo challenge where we randomly selected a participant who submitted a photo, and in April, our winner was Line Wife Addie. So Line Wife Addie, congratulations. She looks fantastic here. And as the winner, you are getting a $100 Victoria's Secret gift card. So congratulations to Addie for that. And also remember that we are now holding a May photo challenge as well. So just like Addie won here in April, we have a potential May winner coming up where we recommend posting a photo of yourself that's taken this year using the hashtag Gara Photo Challenge. And tag our Instagram account at AZBreasts in order to enter to win not a $100 gift card now, but a $200 Sephora gift card. And make sure that when you submit that you make it not private so that it's able to be reposted so that other people get to see your amazing result as well.
Yeah, that's an excellent gift card. That's pretty awesome.
Yeah, I'm excited for whoever wins that one.
I have to congratulate you. I know this is your patient. Lion wife Addie. We'll keep her name private, but we know that that IG ID is hers, and this great result. Really beautiful.
Fantastic.
Congratulations.
Yeah.
You did a gorgeous job. She looks amazing.
Yeah, she did.
And you can tell she's completely happy in the little videos she submitted. So again, congratulations. Great job. Beautiful result from a breast augmentation. She looks beautiful and natural.
Thank you, everybody, for submitting your photos. And please don't hesitate to submit to our May challenge as well.
Excellent. Yeah, and then the last thing we want to say, a couple more words. I know you wrote an excellent blog on honoring our heroes.
I did, yeah.
Tell me what that was all about and why it's important that we do that.
Well, it's just it's a way for our practice here at Gara Plastic Surgery to give back to people that help and better our community, including first responders, military and military family members. So we wanted to give a little token of our appreciation by giving somebody that's associated with either of these groups a small discount. So if you are either a first responder or a military member, please don't hesitate to tell us at your consultation. We will give you a courtesy discount.
Excellent. I think, first responders, all of our military members, they sacrifice so much for us. We benefit tremendously from their hard work, and we're just going to, as a practice, we thought it was important to, reward them and give them a little something back. So we're definitely going to support you in this endeavor and any other endeavors in the future as well.
Thank you very much.
Yeah, thank you so much. Don't forget that you can go to our website at myfaceandbody.com and then also at azbreast.com and see our summer promotions. This is the summer to sizzle. Look for that. There's tons of promotions there for you guys and all kinds of all the procedures really that we do, and I think you're going to love it. And you can look for us at Scott Oakley MD and at Dr. Aldo Gara and also at AZ Breast on Instagram for our before and after photos, for some insightful information, tips and tricks on how to get better outcomes from surgery. And we're posting a lot more than ever on our story. I don't know if you've noticed.
Yeah, absolutely. We've had a lot of patients that we've seen, we've operated on. We want to show the world what we're doing here. So take a look at our Instagrams for all those befores and afters and other fun, exciting content.
All right, and just to wrap it up, what are you doing Memorial Day weekend? That's coming right up, Scott. Any plans?
I think Memorial weekend is a good weekend for grilling, sitting at the pool, and just enjoying life, relaxing.
That's what you do in Scottsdale, right? You sit at the pool.
Exactly. So get your Augs in on time so you can enjoy that too.
I did notice you looked a little more tan today than usual.
Yeah, I know. I thought it was the lighting in here. Maybe not. Maybe it's being in the sun.
Looks like you pre-started Memorial Day weekend. That's awesome.
Exactly.
All right. Well, I'll just be relaxing with the kids. I think they've got some sports.
It sounds like a fun time too.
They always have at least flag football or volleyball or cheering. So we'll be doing the usual routine for my family. But let's thank the audience. Thank you very much for the time. I hope these tips and tricks and these tools here come handy for you. Let us know if you need anything else at your consultation, and definitely let us know if you're a first responder military, because we love you guys and we want to continue to help you. Thanks very much.
Thank you, everybody. It was a pleasure.
Whole life's ahead of you. Can't waste it probing into the past.